So if we shaved off that bump and you took a look at your kind of a side profile, you'd be happier with your nose. If you looked at the front, you'd be more unhappy with your nose. And the reason why is when this is kind of shaved off, it almost flattens it out, and then all of a sudden this looks particularly wide. So if we narrow this by kind of bringing this in at the same time as that, that makes that look much better. Now your tip itself is actually quite good, and looks very good. What's going to be interesting, and we'll take a look at the pictures they took in the other room in a couple of minutes in my office, is we'll take a look at your nose after we just took care of that upper 2/3 of it. And you may look at your nose and say, okay, pretty happy with it, took care of what I wanted, I'm good.
Right.
But you may notice that all of a sudden you may not love your tip and not hate your tip, but just feel like it doesn't connect.
Fit, right.
Correct, with the fit. And so sometimes there is a benefit to narrowing this very mildly and bringing this up a little. Now, when we talk about bringing up the nose, we're not talking about this, which obviously no one really wants, but it's a matter of kind of bringing up the entire nose so that it kind of fits in proportion. And what we'd be talking about if doing anything to the tip would be subtle. Okay, so some people that like need significant work to the tip, but in your case, if anything, it's really more just a matter of trying to keep things in proportion.
Right.
Regardless, the recovery on it is not a lot of pain or discomfort. You're sore for about a week or so. You have a little nasal cast on for a week or so, but after a week, you're back in public and you'll notice you're a little swollen. I'll notice you're a little swollen, but no one else will. They'll just notice that you look good. They may not even be able to pick up on the fact that the bump's gone. It's kind of interesting how it may be something that you're fully aware of. And when you're looking at picture after picture of yourself, you're like, oh, this drives me nuts. And other people, even when it's gone, they notice that you look better, but they can't really put their finger on it, which is really kind of the goal of these procedures. In terms of the overall aesthetics of the nose, not overdone, just kind of the right amount. Downtime, they keep you out of the gym for about 2 weeks. That's probably the most annoying thing to people, but it's a great option for the right patient.
Yeah.
Subtle thing. We're really talking about removing maybe a millimeter, the tiniest amount of cartilage from the tip, and putting in a few stitches to kind of shape it. But what it allows us to do is look at it kind of all dimensions, meaning the 3/4 view, and this is frankly the most important view for most people, because that head-on view is more of a passport photo or a mugshot.
Hopefully I don't have to
right. And the side view bothers us, but the truth of the matter is, how often do we really see pictures of ourselves in a side view? It's not really that. It's usually somewhere between kind of this degree, and this degree, or most of our 3/4 view is actually quite good, because that bump, has essentially been eliminated. Side view similarly looks very, addresses a lot of the concerns. The front view doesn't look, we'll kind of go back to where you were. Night and day difference in terms of what you look like, but really other people are not. What other people are going to notice, interestingly, is they're going to all of a sudden, notice your eye color or notice something else that it's almost like the absence of the nose as opposed to noticing the nose. No one's going to come over and say, great nose job, because they're not even going to realize that you did anything to your nose. It's really going to be more along the lines of seeing your other features that suddenly, are more noticeable because of that. Yeah, and I think it really addresses a lot of the things.
Yeah, definitely. I know exactly what you mean. It's like anytime I turn slightly, I feel like if I'm ever talking to somebody, I always try to look at them straight.
In the lobby out there.
Yeah.
Right. You want this kind of thing, but you're trying to avoid that.
I feel self-conscious about even turning my head sometimes, because I just
you should, because it's subtle, but I get it.
Right.
I get it.
Right.
But that's like such a difference.
Amazing.
Hi guys, my name's Emma and I decided to get a nose job. I chose Dr. Elie Levine's office because I had heard wonderful things about his patient care. He's the type of doctor who really takes the time to explain the procedure with his patients and help ease any concerns before you have any kind of operation. I also really like how high-tech the office is. Dr. Levine's office has amazing technology that I have not seen in any other office, such as the ability to digitally reconstruct your face so you can see what you would look like post-op, which is one of the many reasons why I chose Dr. Elie Levine.
I know I don't have a bad nose. I just kind of want to fix this little bump on the side so that from my side profile, it's just something that's always kind of bothered me, and just like even a minor change can totally make a difference in how you look and that's definitely what I'm looking for today. Just like a minor tweak so that my side profile is straight. So today I'm not really looking for anything super major. I kind of just want from the side to trim down this little bump a bit. It's always kind of something that I've been self-conscious about. And, you know, even though it's not something major, I think that can definitely change your whole look. And even one minor tweak can make a big difference. And that's what I'm looking for today. I definitely would say that I'm a little bit nervous, but I know I'm in capable hands with Dr. Elie Levine. This is something I've always wanted, and now that I finally am coming around to doing it, I'm more just excited, and you know, all the nerves will be over once I see my results, I'm sure. So I like these noses because this one's like very straight and like it's pretty similar to my nose, so it wouldn't require a major change. And I like the way that this one kind of has like a very minor slope, like almost straight with a little bit of kind of like a scoop, but nothing that looks overly done or anything unnatural. And I think these all really suit their faces, and they're similar enough to my nose that it won't be a major change. I also collected some pictures that I don't like because it's definitely important to know what you do and don't want and what to avoid. So going through and looking at these ones, I'm definitely trying to avoid any kind of like snout nose type of look. I don't want my nose to be too turned up or anything, especially like here. I don't want it to seem as if it's too short for my face or as if the scoop is unnatural in any way. So these are the types of nose jobs I'm trying to avoid today. So here are some more noses that I also like. You can see here like there's a bit of kind of a slight angle, but it also at the same time from the side looks really straight, and I think that that's a wonderful job and definitely what I'm looking for today. Even here, I like how the tip of the nose is a little bit like pointed in this one, so it kind of gives like a sharp look instead of being overly rounded. And I think that these tips, the size of the tip, like really matches the face in like a nice proportion in these photos. Even when I feel like I'm taking photos and stuff, even to post on Instagram, I definitely feel like I'm always trying to make sure I get the right angle, and even like totally guilty of editing on my nose at times. And now that's something that I won't have to do. So I'm very excited for that.
I don't mind my tip, I want to leave it alone, which conceptually I agree with, and the idea of changing your tip is not really the goal. But if we take this down, not overdone, but take this down a little bit, and we narrow the nasal bone so that it matches what we're doing here, you will feel like your tip is big. And it's not actually big, correct? It's all about kind of proportions. And so even when I look back at my notes, we talked about kind of subtly bringing this in, because really what we're doing is we're bringing this in and bring this up just to match what we're doing above it, not as a statement, not because that's what our goal is today.
Right.
It's more just a matter of once we've addressed the upper half, we just need to do things just to keep everything in proportion to each. See that you look better, but they're gonna have a hard time picking up on why you look better. They're gonna think like you wear your hair differently to get good news. It's just like, you know, is that a new blouse you're wearing? Were you just on vacation? You know, they'll see that something looks better, but they'll have a hard time kind of picking up on it. And that's really the goal, I think, more than anything else today. And so when we look at you, we're gonna take down this bump just a little bit. Again, not overdone, but to eliminate the bump. This will come in a little bit because otherwise it would look wide after we take care of this. And then your tip, all in all, your tip is very good. It's just a matter of kind of bringing it in just to kind of match what we're doing here. And it's kind of subtle things we're really talking about, but it's just kind of keeping things in tune with each other. So when you look at this, I that looks good. I have no really issue with it. You know, obviously that's kind of overdone. And,
Those are the bad ones.
This is kind of like really overdone.
Really,
this is, believe it or not, I don't actually think it's necessarily overdone as much as it's a small nose to begin with. This is a small nose that was overdone. So, you know, there's, you know, obviously nuances. This is probably the worst of them that you're showing me.
I think like in terms of all the ones we sent you, like these ones are probably the best ones. I do like the look where it's like a little bit angled still, even though there's like a slight, like I don't want it to be super rounded on the end, you know, but I also don't want it to be like crazy pointy. I think like these are kind of a nice balance of the two, where it's still angular.
Not too much definition.
Exactly.
Yeah, like angular but not pointy.
Sure.
Yeah.
all reasonable
Not
things.
too rounded. You know, I just, whenever I see anything too.
There's going to be one little incision right underneath here, but even a week afterwards, when we get out those 10 days later, when we get those few little stitches, even then, no one's going to see it. It's one of those areas that actually heals really well. It's, you know, knock on wood, I've never seen it not heal well. But what it allows me to do is be really precise with those cartilages.
Yeah.
And so if we don't make that incision, I'm seeing about 75 to 80% of the anatomy. We're kind of estimating the other 20%. And if someone has really terrible nose and you're just trying to get it better, that works. But if you're really trying to be precise with it and you really want to kind of measure to the millimeter or half millimeter even, then that's really where it makes a difference in terms of visibility. Everything else will be internal, but you're going to be fine with that.
Yeah. Okay.
All right, I think the key here is just that we're all on the same page
Yeah.
with the picture. You know, pictures
Yeah.
worth 1,000 words. I think.
Sounds reasonable.
Right?
Yeah.
Okay.
So today we'll be performing an open rhinoplasty, and a lot of discussion is given to the distinction between an open and a closed rhinoplasty. And simply put, a closed rhinoplasty is where all of the incisions are internal, and an open rhinoplasty is where there's one external incision underneath the nose in an area that no one really ever sees. It's an area that virtually always heals beautifully. And that's kind of what the average person kind of views as the difference between them. But there's really a big difference when you're looking at them kind of clinically, and that is an open rhinoplasty is where you're seeing 100% of the, or virtually 100% of the nasal anatomy when performing the operation, and so you can be as certain as you can be when you make all of your decisions. And a closed rhinoplasty is where you're seeing most of the anatomy, but you do need to kind of estimate where things are. And obviously with experience, one can really get a good sense of where they are, but again, you're not really visualizing it, you're kind of knowing where they are. So if you're trying to be really precise, an open rhinoplasty definitely gives you more information. And there are times where a closed rhinoplasty is the right approach and times where the open rhinoplasty is. And today, because someone who actually starts off with a pretty good nose and we're just trying to make it that much better, the precision and the extra bit of visibility does make a big difference. And so we're going to perform an open rhinoplasty today so that we can be as precise as we can be. Starting to contour the tip. Contouring involves a few steps, trying to get the cartilages more symmetric as well as more defined, and that comes from a combination of resecting a small, very conservative amount of cartilage and at the same time using stitching techniques to also help shape the tip of the nose. And like anything else, I do think spending those extra few minutes does make a difference. Precision. And we've done all the preparations in terms of placing our field block and letting the medications set in long enough. We'll meticulously separate off the skin from the nasal anatomy. And this is an operation that you should take your time with, because the precision really does matter. We'll work our way so that we can access everything and start addressing the improvements we're seeking to make today. To rasp down the small nasal bump, and after that we will address contouring the nasal tip. And then finally, after that, we will narrow the nasal bones by fracturing them. And that's really pretty much the last thing we do. because we want to really have everything in place before we do that, and that is the final touch, the completion of the procedure. So now we're going to proceed with rasping of the nasal bone. I do think that if you take your time with the injections and the nasal packing, and you take your time with it and allow it appropriate amount of time to set in, it will definitely limit your chances of bruising. There are those patients that just bruise so easily, and it's one of those discussions I had before surgery that if they bruise very easily, more than likely they will. But for someone who's not an inherent bruiser, if we take our time with how we proceed with the procedure, move efficiently, but yet not kind of rush things, I do think it's a little less traumatic and less likely to get bruising and swelling after the procedure. Because each nose is a little different. It's easy enough to contour them yourself. It's not a thing, and you want to just kind of shape it to what they need. And there's nothing wrong with the pre-cut ones. I just find that this is just a little more precise. You get more steri strips, please. Putting on a nasal cast, nasal splint, just to discourage being too active, doing too much early on. Sore. Not a lot of pain, mild soreness, mild headache, lightly stuffy nose, but nothing crazy. All in all, it's going to feel pretty darn good, I think. By about a week, she's still going to be swollen, but going to be swollen very minimally, and so going to be more than presentable in a public setting. We'll feel comfortable going back out into the world. It limits swelling, and it just kind of helps maintain what we did, and it also just reminds a patient, because they generally feel pretty darn good, it reminds a patient to do very little early on. Just kind of take it easy.
I feel good. I feel very out of it still, but I feel good.
You did great in the surgery.
Yes. I don't feel any pain right now, so far so good.
What are you gonna do? What are you gonna go home and do what?
Go home and Netflix binge, get up on everything I've been meaning to watch, and hope for speedy recovery.
Just chill out and relax. It's an exciting day.
So far, so good.
So far, not too torturous, right?
Nope, not too bad. Bruising is pretty much gone, except for just a little bit here. And I'm still pretty swollen, but I don't feel the pain anymore at all, which is really nice. After the first few days, my recovery has been rapidly improving.
Oh my god, oh my god, oh my god. What do you say? You want to see it with the stitches?
Oh my god, wow, it actually looks really good. Wow, and I'm not too bruised. I love it. Wow. I'm happy. I'm happy. I was warned by some friends who've had the surgery that not to expect too much getting my cast off, but I'm pretty happy with how it looks so far.
It's only gonna get better.
Stitches are all out and I'm very happy so far. I still have some swelling on the tip which will go down, but I'm loving how my new bridge looks in my profile. I'm very happy.
Wow. You have like next to no swelling. I can't get over it.
I've been taking my arnica.
No, it's just after those pictures you showed me of your girlfriend.
Yeah.
She looked like she was hit by a truck.
I know, I was expecting that.
Today marks the 2-week mark since my procedure, and I am healing very nicely. Swelling has gone down dramatically, and it will continue to go down for the next few weeks, so this is not the end result just yet, but so far I'm really pleased with how I've been recovering. I'm not in any kind of pain at all. I've been out and about for the past week or so since I got my cast off, and I can't wait to see the final result.